Welcome, and thank God it's Friday, y'all. Thank you for joining us today for our data insight session on our second nonprofit pulse survey. As you'll hear today from our colleague Rita Taylor, this second nonprofit pulse survey is a follow-up to the original survey that Mission Capital was proud to spearhead along with many community partners at the end of March. And as we all know, the world has changed in just these last 6 weeks as we navigate the impacts of COVID-19 in our region. And for the second survey, Mission Capital really wanted to lean into our strategic direction of supporting leaders, organizations, and networks as we advance equity and opportunity in Central Texas. And so we wanted to ask direct questions about how historical inequities may be showing up during this COVID-19 environment. And we know that now more than ever, the stakes for communities of color are even higher than before. And so we're really honored to have this conversation with all of you this afternoon. We're also grateful for the solidarity of our community partners who chose to participate and promote this survey with us. And we added additional partners, as you can see, and I think we're moving along with our slides. So to recap today's agenda, we'll hear from Rita Taylor, our Senior Consultant for Data and Research, who will share an overview of the data findings. We'll then open up a brief Q&A session via chat after Rita's presentation. And then we'll host our colleague, William Buster, Executive Vice President of Community Investments at St. David's Foundation, to join me in sharing some brief reflections on the latest data and why it's important. We'll also learn how a community funder like St. David's Foundation is responding and learning as this global pandemic evolves. And so at the end of our session, we'll wrap up sharing how you can get involved as we look to collaborate and connect with one another. So again, I thank you for your presence with us this afternoon, and I'll turn it over to Rita.
Great, thank you, Madge. Hi, so I'm Rita Taylor. I'm Senior Consultant for Research and Evaluation at Mission Capital, and I'm really excited to share the results from the second Pulse survey with y'all today. As Madge already mentioned, the history of the Pulse is that we conducted a survey in March, trying to understand the immediate needs of organizations. And what we want to do this time around is better understand the ongoing needs, but we also wanted to expand, and we're going to talk a bit more about this, expand the survey and think more critically and take an equity lens through it. So with 16 intermediaries and stakeholder partners this time around, with Mission Capital being the backbone, again, we created another survey, a new survey, and sent it out April 28th. It was supposed to be open for about a week, and then we decided to extend it to increase the numbers. So it was closed May 8th, and we have been quickly looking at the data. And of course, that's a very short timeline to look at that data. So what you'll see today is definitely a summary, a very high level summary of what we've been able to learn so far looking into the data. And we've had 428 responses, unduplicated by individual. I do want to make a quick note about that methodology. We had 432 total responses, and then controlling for duplication, we analyzed about 428 total. And then we also had it was optional to provide contact information. So there are about 40% of the respondents who did not provide that information, so we cannot really control for duplication in this survey the way maybe others can. So with all that caveat about this data, just to make sure we're sharing all of that up front, I'm going to just go straight into it. So we had a lot of insights in this, but before we really get into what we learned, we want to kind of level set on the context of this survey. So just like with the last survey, it opened up when people were really starting to move into the crisis, and there were immediate needs. And since that point, which was a month ago, we've learned a lot about what's happened. Over 30 million jobs have been lost in the last couple of months. We have a 14% unemployment rate currently, and that is disproportionately affecting people in our communities. As was announced yesterday, there's a 40% unemployment rate in households, for folks in households making less than $40,000 a year. There's an 18.9% unemployment rate for Latinos and Hispanics, 16.7% unemployment rate for Black and African Americans, and then a nearly 32% unemployment rate for teens, specifically 16 to 19 years old. So and there's just more and more data out there starting to show the disproportionate effects of COVID-19 and the pandemic and the results in our economy and on health. There's just a lot of information slowly starting to come out, but it's definitely painting an important picture about inequity. So back to the survey, thinking about all of these complications and the timelines. What's different this time? We already mentioned that the survey is, of course, at a different time. Not only is it a different time, a month later, it was open for 2 weeks longer. There was a lot going on at that time, more and more knowledge about the challenges our society is facing around COVID-19 were coming to light, especially when it comes to inequity. We also definitely didn't see the same response rate. And not only did we not see a response rate, we didn't expect to see the same response rate. We knew going into this survey, the second one, that we would not be able to compare the surveys to each other. So just making sure I level set for everyone that this is definitely not a survey for benchmarking. This survey is a snapshot in time, and we're trying to understand the sample that we were able to get in this survey. So just making sure folks don't compare this to the previous survey because the sample's different. I'm going to go into why in just a minute. All right, so one of the main reasons why the sample's not the same is we ask different questions. We used the last survey to help inform and hone this current pulse survey because we were able to get insights from the last one. Oh, we need to ask that question this time, or include that in that particular question bank. The other thing is that we're really leaning into trying to understand equity and opportunity and advancing that within the social sector. So we asked a number of questions in the survey that we were hoping would help us better understand that. And again, this is high level, so we're still looking at the data. But one of the questions we asked was, do you identify as a person of color? And we also asked folks to identify themselves, identify their race, and there are multiple options. You didn't have to choose just one. And we ended up deciding to look at the data today. One is the larger sample size, but also there will be a few times where we point out the differences for people who responded that they do identify as a person of color versus people who responded they do not identify as a person of color. We also asked a question in our survey, which is definitely the part that we want to dig into more and will not share a lot of today. But we asked a question of folks, does your organization primarily serve any of the following groups? And you could choose all that apply. So we asked folks to just click essentially, do you serve this group? And we created this list from a number of different sources, but kind of the founding source was the NAACP's information on like predictions on COVID-19's disproportionate impact on folks. Communities that might be, well, quite frankly, just disproportionately affected. So we took those lists and we asked folks to check those off. And we did see some very interesting things, but we need to dig deeper to really understand it. So you'll just see a little bit of that today. The other thing we did is we wanted the survey to be more inclusive as far as who took the survey. For the first pulse survey, we really were trying to get folks who were in that most senior leader role in their organization. And this time we really wanted to not only ask some of the similar questions we did last time of that particular group, but we also wanted to ask other questions because a lot of what we're trying to do is understand organizational needs and what people who are in the nonprofit sector are perceiving of the needs of the folks they serve. So we wanted to make sure to extend that to more than just that one role to take the survey. I don't feel like we got the numbers that we were hoping to be able to really dig into that information. Specifically, we wanted to hear more from folks who might check that program or service delivery box and hear what they are seeing as far as needs are concerned. So just making sure you understand who's taken this survey and what where we were trying to better understand some of the differences and nuances. All right, so what did we learn? Well, I think the top headline, especially when we leaned into the qualitative data, which was something we're really trying to do with this survey, as opposed to just focusing on quantifiable data. Kind of the top headline is this uncertainty and question of what's coming in our sector and in our society and our communities, and how will we meet that need? And so the top needs that were identified by respondents were, of course, funding and financial support, specifically needing more operational funding and flexible funding, resources to pay for things they may not have had to before and don't have the dollars now. We're going to dig into that a little bit too. And then organizations also identified opportunities for strategic guidance or planning support, or just the time and need to do that for themselves, not necessarily even with anyone else, just there is this need to do that work. Of course, as many of us may be experiencing, there's a need for support for digital, to support the digital shift that we're experiencing right now. A lot of support for both staff and to do their work, but also to serve those that they serve. So that was a really big one, those three. And then we also saw an interesting pattern of organizations in the qualitative data wanting or needing additional staff or volunteer support to do work, especially as the need increased, which is another thing we're going to talk about briefly. And then we also saw quite a few folks describing needs around not being able to reach or communicate to the people they normally serve. Just lots of challenges around that. Then we definitely saw a lot of interest or need around guidance for reopening. It's definitely not just a social sector need, but we saw that in the qualitative data. And then we also saw a lot of need around supplies and safety equipment, like PPE. Now, what were the needs? We also asked folks to answer a question about the needs that they were seeing in the communities that they serve, like the top needs. And a lot came out in that data, a lot of really rich information, which is what we were hoping for. But the four kind of top needs that bubbled up in our analysis was that a lot of folks are, of course, needing financial support for lots of different reasons, but job loss is one. There was a lot of entries around the mental health of those we serve, in addition to, of course, the people that are serving through the nonprofits, but also for the people that are being served, and some of the needs that might be coming, that are now, but also be coming in the future. And then there was a lot of need around food, supplies, housing, and transportation. There were a number of stories that reflected those needs. And then also, as already mentioned, the digital and technology access challenges, inequity that we're seeing in our communities. That was also another top need or challenge that respondents felt like the folks they served needed. So at Mission Capital, what are the top insights we felt like we drew from the analysis? So what's interesting here is that a lot of folks described the need that they saw in the communities, but a number of respondents also talked about conditions that will clearly lead to greater need or greater impact on the nonprofits trying to serve those areas in the future. So I just pulled out a few qualitative entries and anonymized them if they were identifiable. So one is child abuse reports have hit unprecedented lows. Children no longer have access to teachers, child care workers, and other professionals who might be able to recognize and report child abuse. Reports are even lower than traditional summer months because children are more isolated than ever before. Poor healthcare due to medical offices not taking patients at this time, or parents' reluctance to visit medical facilities due to them being a high risk of exposure. So there are a number of different examples that came up in the data like that. We have many more, but we're just sharing them here in these slides. So the other thing that was really interesting, as far as we routinely saw in the data, this compounding effect of inequities as far as the qualitative data is concerned. And that was really interesting, and we have a lot in these decks, and we're not going to share all of the qualitative information, of course, but just a few that illustrated this compounding effect. There's a technological gap. Low-income students are not able to access online learning. Families need assistance with rent and utilities. Students feel lonely and isolated. Access to emergency food distribution sites. Many families do not have cars, and emergency sites are not within walking distance of their homes or schools. Lots of families have been laid off, and they do not have enough money to pay off their bills or food. Very fragile seniors, who are typically 85 plus, are slipping through the cracks because they require specialized care and services. I'm referring to seniors who are not going to be able to maneuver the 211 system, be on a 7-day wait list, order groceries without assistance, and can barely walk around their homes. And then a few more examples. Marginalized communities are experiencing the greatest challenges because they lost jobs or work in environments that expose them potentially to COVID-19. Oftentimes, they can't afford rent, utilities, and other living costs. It's exacerbated by language barriers and the fact that many aren't eligible for CARES Act or stimulus funding. psychosocial support to address isolation, avenues for clients to connect virtually when so many POC are on the other side of the digital divide due to lack of computer in the home or internet service. So there are lots of really interesting, deep qualitative insights that we were able to grab, but part of what is important to point out with a lot of these entries is, while they may not have explicitly called out equity in their entries, they were illustrating the compounding effect of inequity and what the nature of this pandemic, how it will further that, or there's a risk of it furthering that. And I think the numbers are bearing out that that's true. So that also led us to be thinking quite a bit about this data and what these two things kind of say. And a lot of organizations described needing financial resources, especially flexible dollars and operational dollars, specifically to support the pivot. So as needs are rising and there's a fast changing environment, but organizations, as we're also going to talk about, are losing operational dollars, how do we support the learning and iteration that must occur to meet the needs of those we serve? So we saw a number of entries in the data that kind of pointed to this pivot and the challenge of navigating the pivot. This one entry, or one respondent said, understanding from supporters that our programs and services will continue to evolve to meet the changing needs of those we serve and to adapt to the changing conditions in which we must operate. Expectations will have to change. Flexibility with current grants. For example, we have a grant to provide services in schools. Well, schools aren't open, but that funding pays for staff. Shifting priorities to better serve our families and funding to support the shift. We need to not only be ready to serve our communities in the current needs they have, but have the ability to help them craft their individual road to recovery as a new normal comes at very unknown times. So those are kind of the top insights that we felt like we observed in the qualitative entries and that we felt like would be important to share before jumping into any quantitative data or quantifiable data. So now let's talk a little bit about that data. So as I mentioned, we asked questions that allowed us to separate the data out based on how people responded at the front end for their identification as a person of color or their identification in their role in their organization. And while we may have had 400 plus responses total, when we got down to the number who identified themselves as one, working for a nonprofit, and two, in the most senior role, we had those respondents answer other questions about operational capacity and financial capacity. One reason we did this was to help reduce duplication in the data so that we could observe that. All right. And if anyone wants to talk more about the methods, feel free to reach out. We're going to provide contact information at the end of this deck. All right, so just very quickly, some of the very interesting things that we saw. 69% of those respondents indicated they were experiencing disruption of services for their clients and communities. 52% were seeing an increased demand for services, and 37% were experiencing a significant expansion in the types of needs their clients and communities. And then 40% had changed operations to more directly support COVID-19 response. And 30% had engaged in strategic partnerships with other organizations. And we saw some very interesting things in the qualitative data as well about organizations who are making strategic shifts to collaborate more. And we're going to talk about that some too. Organizations also experienced staffing challenges. Almost 30% experienced increased staff and volunteer absences, 26% instituted hiring freezes in the sample, and 14% had reduced employee hours or instituted furloughs or layoffs. When we looked at that particular data set, or those numbers, we also then cross-referenced to see if there's any kind of, who is experiencing a need, the need shift for the folks they serve, but also is having a staffing challenge. So if someone responded that they are experiencing increased need, but also at least one of those staffing challenges, there's 26% that had both of those. All right. As we already mentioned, there's a lot of challenges around technology right now. 58% described challenges related to staff and volunteers needing to work remotely, and 47% indicated they're having challenges having the right technology to do their work. And so then, as I mentioned, we looked at the data. We compared folks who identified themselves as a person of color versus those who identified themselves as not a person of color. And there were a number of people who skipped those items as well, so those are not in this particular sample. But as a result of COVID-19 pandemic, what operational ramifications has your organization experienced to date? So what we did is we pulled out examples where there's a 10% difference in this case. So in this case, 60% of those who responded that they were a person of color experienced increased demand for services or support, compared to 50% of those who did not identify as a person of color. And then 51% of those who identified as a person of color were experiencing change their operations to more directly support COVID-19, compared to 37% of those who did not identify as a person of color. So one other thing we did, and this is the data that we're still looking at, so this is very, very preliminary, but we had an item in there, as I mentioned earlier, where people could identify who their organization primarily serves, and it's a check all apply, so you can answer all of them if you want. But the one thing we did is we pulled out the percentages of those who said they primarily serve populations of color. They may serve a lot of other types of populations as well, but we just pulled that particular group and looked at them compared to the total percentage. So we do see some differences, and we pulled out those again that were 10% difference. So for instance, we see for increased demand for services or support from your clients and communities. We see that organizations who indicated they primarily serve communities of color, 68% of those organizations are experiencing increased demand. 38% of those organizations are experiencing disruption of supplies. 48% are experiencing a significant expansion in the types of needs for their organizations. And 45% have engaged in strategic partnerships with other orgs. All right, so now we want to quickly look at financial impact. So we also asked questions around that. We asked a lot of questions. We're only showing some of those just for the sake of time, if nothing else, but we will also be following up with more information as we dig into this data more. So in this particular item, we have 61% identified that they have canceled fundraising events, and 50% have reduced earned revenue, 53% reduced individual donations, 28% reduced grant funding, 29% reduced in-kind donations. So this is all funding that can be used for operations that can sometimes be more flexible, not always with grants, but with the others. We also saw some organizations, 7%, saying they had no significant financial impact, and 10% saying they had an increase in revenue, donations, or funding. And then we had 31% of organizations say that they took program-specific funding and transitioned it to general operating funding. All right, again, so when we looked at those who responded identifying themselves as a person of color versus those who did not, also the items that had a 10%, more than a 10% difference. So that program-specific funding transitioned to general operating funding. 35% of those who identified as not being a person of color had experienced that, versus 20% for those who identified as a person of color. And then delayed grant payments, 30% of those who identified as a person of color were experiencing that, versus 12% of those who did not identify as a person of color. So again, we looked at the data for those who identified themselves as primarily serving organizations or communities of color, and we also saw some differences there. Again, in the delayed grant payments and the reduced in-kind donations, which was also interesting, and then reduced grant funding. All right, and we're just about done. So very quickly, I want to go over some of the financial information. So just like in the last survey, we also this time asked folks how long they estimate their organization could operate at current capacity with their current expenses and income. And you can see that there's about a 50% split at 4 to 6 months, less or more. And if you look at that as person of color versus not person of color, you see that there's also an interesting difference. All right, and then finally, we also asked questions about grant funding, but the one we wanted to show for this particular case is that, does your organization receive grant funding from either public or private sources? And 71% of people identified as person of color indicated they did, versus 89% of those who did not identify as a person of color. So very quickly, what's next, especially for Mission Capital? So at the end of the survey, we asked folks if they were interested in collaboration opportunities. What were they looking for? And based on anecdotal information and other information we were receiving over the past month, we put these categories in there, and we asked folks to indicate that they did. We had a lot of responses for folks who want to be connected or collaborate around technology and digital access. 102 for health and well-being, 89 for basic needs, 83 for supplies and personal protection equipment, and then 84 for mental health, and a lot more for the others as well. So Mission Capital is going to be working over the next several weeks to develop programming to support these types of collaboration and connection opportunities. And that includes potential changes in membership. And Chelsea's going to mention a little bit more about that towards the end of this call and how you can get engaged if you want. All right, so we have a few minutes for some quick questions about the survey before we transition into the conversation with Madge and William.
Wow, Rita, thank you so much. Can you hear me?
Yes.
So this is Tara Kirkland, Chief Program Officer for Mission Capital. And while you all are chatting your questions, I'll just see if I can summarize or ask you to summarize, Rita, kind of what I heard. I know there was so much rich data that you were sharing, but what I took away from that, and you tell me if this is a fair summation, is that when we look at all of the responses, we can certainly see people are, they're doing okay for now. They're concerned about the coming wave of needs and their ability to know how to meet those needs and whether they'll be able to make that pivot that you pointed out. But then when you disaggregate the data and you look about respondents who were people of color versus non-people of color, you start to see, again, some sort of differential or compounding concerns and effects, both in terms of cash runway, ability to turn their funding into be more flexible, and the like. Am I understanding that correctly?
Generally, yes. For those types of items that we feel like are important for organizations to be able to pivot and address the needs that may be clear but not quite sure when it's going to come. That's where there's some difference here in this particular sample, and I think that there's a lot of opportunity to ask deep questions about why those numbers are different and what can we do to support reducing inequities.
Great. And just a clarifying question that's coming through, what was, again, the percentage of EDs or CEOs who identified as person of color? And then I know some of the other responses were everyone who took the survey. And can you share what the percentage of folks who took the survey were that identified as a person of color?
Yes, it was about 25%. I can go back to that slide for the full survey.
For the full survey.
Yes, I will need to pull up other information about the breakdown of that 200.
Okay,
because
perfect.
each item is different.
Okay. And then we're getting a question about the cash runway and changes from the first survey, which I know, again, as you shared, we're not able to benchmark, but we did see some interesting sort of differences that maybe had to do with the PPP coming into light. We're just asking for any reflections on cash runway differences between survey 1 and survey 2.
Yeah, I really just, unfortunately, I have to say we can't compare the two. We can't compare the two because the sample is different, and we can't compare the two because the conditions are very different. So we did actually ask questions about PPP in the survey, but there were two reasons we decided not to share that data. One is that the survey, we extended it a full week, and it opened about the time that the second round of funding for PPP, or the CARES Act, was being disseminated and people could apply. And so we know that the questions we asked, such as, have you applied for PPP, or have you received funding from PPP, those kinds of items, like someone, if they answered it the first week, could be completely different the next week. And even if they answered it the first week, it could be different next week. So as far as being able to understand that information in the larger context of what's going on, we really can't answer that with the data we have.
Thank you for that question. All right. As we're waiting for some other questions to come in as well, Rita, I'll just ask you, when you looked at the qualitative data, you were talking about the top needs that came up. Was there anything not on the survey that really stood out or surprised you as you and the other folks going through those qualitative responses that you would want to
Sure. Yeah, I think two things came out for me, just looking at the qualitative entries that we did not ask about in the quantifiable stuff, is one around mental health and support for staff, and childcare. So both of those things came up, as far as like childcare seemed to be a barrier for reopening. And all, I mean, there are lots of barriers for reopening, but I think there are a number of questions that could be interesting to answer about those things that we could understand more. I wouldn't say we can generalize from the survey, but we could understand more broadly if we'd ask questions that we could quantify around those things. And just like the first survey, we identified things in those other categories because people could provide open responses that we then added to the survey. For instance, we asked this past time around about whether organizations have stopped all programming, and we had a few other items that we added this time that didn't have a huge response rate, but definitely are in there. And we will be planning to share more of this information out as we continue to analyze the data.
Great. So I got a question. Are you trying to gauge the perceptions of the impact of the pandemic among professionals of color versus white professionals? This is not clear to me.
Yes, thanks for that question. I'm not sure. The questions are definitely perception based. So they are, the items definitely ask folks, are you experiencing this? And that is a perception question. So yes, we are definitely asking that. And then we do want to better understand the differences of experience for folks who self-identify as a person of color versus those who do not. Mostly because we know from other research that there are differences, and we know from folks who share lived experience that there are differences. And we want to better understand what those are. And so that's one reason we were trying to ask those questions in this survey. And without asking those questions in the survey, we can't know. From data like this, at least.
Great, thank you. If that didn't answer your question, please chat a follow-up.
Definitely.
And I'm seeing we have another question around technology. So Rita, when you say technology, do you mean only having access like high-speed internet and/or devices available? Or does it also include things like virtual meetings, using technology to reach constituents? What do we mean when we say technology?
Yeah, that's a great question. So in the qualitative entries, the way we coded is we had broad codes because of one, our goal of trying to better understand where challenges are showing up, but also because of our goal to start trying to build collaboration connection opportunities. So in the qualitative data, when we asked about technology, or when we coded for technology, it was quite broad, but examples are, yes, there is a lot, like some communities or individuals do not have access to internet, much less high speed. Some groups or some individuals or organizations might be struggling to support their staff with the right devices or software to do their work. I don't know if we saw a lot about virtual meetings specifically, or certain types of software. There were broader kinds of things that both when the organization's responding about their need as an org, and organizations or respondents talking about the needs of those they serve. Often the two challenges are the orgs don't have the right technology to work together, and they're having to reskill or learn new skills to do that. And then two, folks who they can't reach the people they serve because they don't have the technology or access to internet, or maybe they have they're challenged by having one or two devices in the home, and it's hard to reach. There's really rich details that are just really hard to share over a quick 20 minutes webinar.
Great, thank you. Well, you know, we've mentioned connectivity and connections a number of times. We also mentioned that nonprofits expressed a need for additional staff and volunteer support. So wanting to know, I think, and this may be our last question, but what's behind that? Is it not having the funding to hire staff? Is it different kinds of volunteers being needed? Is it uncertainty about whether they can access the population safely? Trying to understand a little bit more, since so many people are looking for jobs. They want to know what's the mismatch there. What do we know?
Yes, so there's definitely there were a lot of responses around this. Some organizations are experiencing increased need and they need to staff it, but it's not always clear if they can hire, or maybe they had to freeze hiring even though they need that support to fulfill their mission or to support the people they're serving, but they can't. They really have to protect their financial reserves because the future is so unclear, and they may not have the flexible operation dollars to transition money to pay for staff. They have financial dollars that pay for a specific outcome and specific program or project. It was a wide variety of things that were described, and this also it was hard even in the coding to think about, is this a challenge around labor? Is this challenge around paying staff? Because there were a lot of other people a lot of respondents were like, we need more volunteers to do this, or we need to be able to support our staff and being able to go do this safely. There's a lot of stuff around that, but for the most part, the coding is really more about additional staff or volunteers to support the work.
Mm-hmm. And it might be different kinds of volunteers if groups have primarily used seniors and those folks can't feel safe doing the job, that might have showed up as well.
Yes, it's really rich information and a lot of it.
Well, thank you all so much. I want to, I know we could sit here and kind of dive into all of this all day. And Rita, I know this is all very fresh. And as you said, we're going to continue to analyze this and make opportunities for others to continue to ask questions. And on that, we're really excited to ask Madge and our special guest, William Buster from the St. David's Foundation to unmute themselves and share their videos and just have a little real-time kind of reflection on this hot off the presses data. And while they're doing that, and Rita, you're advancing to the next slide, just a last confirmation. Did we collect contact info, and are we planning to do another pulse survey soon? So I know the collaboration slide that you put up had the list of folks who said they did want to stay involved, and we are going to be back in touch with those folks. And Rita, as you mentioned at the end of this webinar, Chelsea is going to also mention how anyone who's on the webinar who wants to plug in and collaborate in those areas can also dovetail with that. In terms of the pulse survey, I think we're going to take stock after this, right? And really see what's most needed moving forward.
Yeah, and I also want to make sure to make a note about the contact information. So in trying to make sure that the folks could be as anonymous as they wanted in the survey, every single response item was optional, including contact information. And we were clear that the contact information would be used for to identify duplication and remove duplication from the survey, just for analysis purposes. And then we also, if people wanted, they could opt in to using, for us at Mission Capital, use their contact information to connect with them about collaboration or connection opportunities around the topic areas they expressed interest in. So we do have that information, but it is strictly for those purposes, and we're being very careful about that. We want to respect everyone's anonymity in this survey. We really appreciate everyone providing responses.
Thank you, Rita. Thanks for your leadership, you, Tara, and the rest of the Mission Capital team. And it is my honor to be joined by my colleague, William Buster, Executive Vice President for Community Investments at St. David's Foundation, for a bit of a reflective conversation on what we've just heard. And so, William, we'd love to hear generally what stood out to you from the data presentation. What are your first thoughts as you hear?
It's, Madge, thank you. And first, thank you all for spending your Friday afternoon with us. Just the very first thing is the fact that so many people are responding. And what it says to me is that not only are people trying to kind of do the work that they have been tasked to do, but they want people to know. They want us all to understand what they're going through, and they want help. They want to know that someone's going to be on the other end of this listening to them. And so that's the first thing. But I think I break up my kind of reflections in two different ways. One is the reflection of how people are viewing the work and what's happening with their work. And then there's the part of the reflection that kind of focuses in on organizations, the effectiveness and the impact of what's happening in the organizations. I find it it's hard to reconcile that there's a lot of silent hurt that's happening for some of the populations that these organizations are supporting, where we see a drop in reporting around child abuse, where we all know, and I know for a fact, that all the data says that during these types of situations, abuse increases. And since we have numbers that are saying that we are even below summer reporting, that scares me a lot. And I think we should be thinking more about that, particularly those who are most vulnerable in our communities. And I would add to the children aspect, I would add seniors to that. What's happening as it relates to the care for seniors. We know that there's a lot of senior abuse that happens. And so I wouldn't disconnect what's happening with children from what's probably happening with seniors, because they're both the most vulnerable in our community. Mm-hmm. This issue around this kind of growing understanding of the difference of how the pandemic is not the great equalizer. Like, the pandemic is exposing some rifts in our communities that we all know have existed, and it's making me want to kind of understand. So what are we going to do about the fact that this is impacting people of color differently, impacting African Americans from a perspective of health differently? And then this notion, one thing that really jumped out, and I'll be quiet and move to the next question, is, and as a funder, it just jumped right out at me. The question about release of funds to organizations, and the difference between people of color-led organizations and majority-led organizations, and how either the money was slow in getting to them, or whether or not their grants were moved to being general operating. That's something I'd love to kind of dig more into, because that's for me as a person in my field, that's upsetting. Mm-hmm. To have more of a conversation about that. So those are my initial reflections, Madge, but I have a lot more if you want.
Thank you, William. And that's a perfect segue actually to the next question. We know that the nonprofit partners who took the survey are curious about how funders might leverage this data for their work in decision making. So tell us a little bit about what that might look like in the philanthropic community. What are you hearing from funder peers, and what are you talking about at St. David's?
Well, so those are two different questions. Yeah. So what are we talking about in the funder field, and what are we talking about in the St. David's Foundation? So, I've had the opportunity to be a part of a lot of conversations that's happening both regionally and nationally within the field of philanthropy. And I don't see a lot of folks rushing to get this type of real-time data. Like, honestly, like, people are getting, there is data about what's happening to communities, but from the perspective of, okay, specifically organizations working on the ground, tell me what's happening. I think people are getting a lot of information anecdotally, but I haven't seen it could be happening, but I haven't seen a lot of organized efforts to pull this data from organizations in a data analytic way. So how we're using this kind of information, what's been most helpful, when we begin to understand that there was going to be an issue of how this was going to impact our communities within the foundation, one of the first questions I asked the program team is, what are you hearing from the organizations that we support? Call them all up and ask them what's going on so we can better understand. And so we were, we reached out to our 80 plus partners, but I knew that was just a small sample of what's happening overall. And when I heard that the Pulse survey, the first one was going to happen, I said, that's it. That's what we need. I need that information so we can better formulate how we're going to respond. I didn't want to just rely on our partners. I wanted to rely on organizations that we often don't have these relationships with. And so for us, it's directly impacted what people are seeing that we've done. One, the first thing that we did was that the first thing we were able to do was say, okay, all of our partners, you don't have to report what's happening. Just do the work that you have to do. Forget about what we're reporting. The next thing we were able to do was, because of what we began to hear, is people they didn't say they needed general operating support, but what they said was, I can't complete the work because I have all this programmatic dollars, but the need is beginning to kind of emerge for our clients, and so we need help for that. So the next thing we did was we made all of our grants general operating grants, and total about $16 million just freed up automatically. And then as we pulled the more specific data from the first survey, as we began to kind of determine what we were going to do next, it directly helped us create kind of what we were going to do within our own fund that we created. So the fund that people have seen that St. David's Foundation has stood up over the last couple of weeks was directly influenced by what all of you put into your surveys from the first time around. And what's going to happen from now on, because we know that this is going to emerge, the issues that people are going to experience are going to continue to kind of evolve. We're going to continue to evolve our response. It's absolutely critical that we don't remain static. For those of you who've been around in philanthropy for long enough to have been around things like Katrina and Rita and all those kinds of things, you know that what's going to happen as far as the disaster goes, that's what we are dealing with, a disaster, is that the need is going to evolve. The thinking is going to evolve. The responses are going to have to evolve. And so we need this information so we can stay current with what the needs are in our community.
Mm-hmm. Thank you, William, and thank you to St. David's for your bold leadership in immediately responding and converting what were traditional program grants to general operating grants, what we as nonprofit leaders call the manna from heaven kind of, flexible funding to really respond in an emergency moment. So we thank you. Would love to hear any other closing thoughts or reflections in terms of what's your hope for what we as a community might do with this data moving forward, and also just thinking about this unique moment of COVID as an emergency that's also forcing us to really grapple with inequities in a different way and creates opportunities, I think.
Yeah, Madge, I hope, one thing, I was impressed that some folks are having the ability to think about the pivot and what happens beyond 6 months, what happens beyond 12 months. I was impressed to hear that and see that. That's something that I've already began to do myself. I'm thinking of this, and I've said this before, and I'll keep saying, folks, I'm thinking of this in kind of two different ways. One, there's an 18-month kind of horizon that we as a foundation that we're working from right now, and then I see an additional 18 months. So at least a 3-year kind of time horizon that we need to begin thinking about what's going to be happening with our organization specifically. But for me, I can't, just what I'm hoping for is, as we continue to recognize that the disparities that have been laid bare by this pandemic become more in focus, that we don't, it doesn't become a blip in time. We in philanthropy, and oftentimes our partners in nonprofits, we got short memories. And we want to move on to the next thing because there's another problem. This is an opportunity to take a breath and to say, what are we going to do about this as a community? Forget about what's happening across the country. I'm gonna focus in on Central Texas and say, we're getting some really good data about what's happening, both within our communities and both within our organizations. And so what are we going to do with that data? How are we going to reconcile the differences in what people of color-led organizations, the resources that they have access to versus majority-led organizations? What are we going to do about that? How can we as a community have those conversations that we all feel that we can be heard and that we can all kind of take the step forward? Because I do believe that there's a consensus that we all should do something about this. Mm-hmm. Leave that from this community, from personal conversations to what I've seen in our work. And so I'm not going to forget. And, as y'all see me around and about, when we can start seeing each other around and about, If you want to check me on it and ask me questions about what we're doing, ask me those questions about it. So as a foundation, we're trying to move in this direction as well, trying to better understand it. We don't know yet. We don't have we're still growing ourselves in this understanding. But I think we're going to do something about it to the best of our abilities in the time that we have moving forward.
Thank you, William. We really appreciate your bold leadership and your call to action for funders and nonprofits alike. And so that's a great segue into our wrap up. And so William, thank you so much for being with us this afternoon. And I'll pass it over to our membership manager, Chelsea, to take us home.
Yes, I just want to say once again how grateful we are to all who have shared their reality in this survey. And at Mission Capital, we really took seriously that we heard from both surveys that we need to go beyond data collection, that there's understanding community voice, and there's also addressing the priorities that we've established. So we really took what people messaged us as something that they wanted to connect and collaborate on together. And we're seeing that these are the focus areas that we really want to address in the coming phases. So our call is to you. We want to know from you what you need from us to be involved in addressing these collaboration areas. Is there something that we can do specifically that would help support your connection to us or to each other? You're welcome to chat your answer now, but we're also asking this in our survey evaluation and our follow-up, and you'll hear lots from us in the coming months. I'm also linking here the evaluation. We of course want feedback on the webinar, the data, but this is also the opportunity to kind of raise your hand and join a collaboration opportunity. We're absorbing now how do we shift membership to make sure we address and create these collaborative opportunities, and you'll be hearing more from that from us as well. Just one other note, we do have an event coming up that may be of interest. It's an interactive discussion of existing local data sets that can inform the COVID-19 response and kind of identifying what's helpful and what's missing. So we will include that in the following, in our follow-up email as well. And last note, if you have further questions or resources to share, or just want to reach out and connect with us, please, we are here. We're monitoring info at Mission Capital, membership at Mission Capital, insights at Mission Capital are all data, our data specific responses. Yeah, we're here and we're excited to be working with y'all and responding to y'all. And just one final note as we close, we want to take one more moment to thank all of our supporters who make today's webinar and our COVID-19 response possible. To the foundations, the business organizations, the community responses, Aragona Foundation, Blackbaud, HEB, Michael and Susan Dell Foundation, RISA Foundation, St. David's Foundation, Stillwater Foundation, UFCU, and Wells Fargo. Thank you. We could not be doing this work without y'all, and we really appreciate it. So thank you everybody for joining us today, and we will be here if you have any needs. Please reach out. We look forward to hearing from you.